So I think at VCU we have a very strong MSK Fellowship program, whether your ultimate goal is to end up in academics or private practice.
We really prioritize fellowship education. So we have fellows concentrate on cross-sectional imaging, procedures that maybe they're not super skilled at or haven't mastered yet, and make that the priority for just on a day-to-day basis, rather than have them reading tons and tons of radiographs or doing things that are more, time-consuming and not necessarily educational.
I think our faculty is diverse, our training is diverse, so it makes them fit in. And it's not all our faculty members really care for it.
I think one of the best things about our fellowship program here is just our collegiality. Makes such a huge difference working with people who get along with each other and have just sort of really easy, natural communication.
The team works well. They're responsible for covering 3 sites, as I mentioned, the Stony Point and Short Pond outpatient sites, as well as the VCU hospital. This fellowship provides excellent teaching, one-on-one teaching, and I find that to be the case every time I read out with the attending.
We have a really good work environment. The kind of work that we do is amazing, and then at the end of the day, they are gonna feel that they finished their training, they are very proficient in all the musculoskeletal radiology pathologies, and also that they had a really good year interacting with other people.
Well, fellows are spending a year of their life to get a set of skills, and that's, I think, what we think about our training here, is to make sure that at the end of the year, fellows have everything they need for their future job.
All of the faculty have tremendous knowledge base and are eager to share that with you. And, I learn something new on every readout with every case from each and every faculty member.
Different subspecialties within the hospital that are like the top of the state. So everybody will come here and get referred here. But we still do get all the trauma also coming in, and it's a very good mix. I feel like you'll be very trained to go wherever you want to go. If you go to a rural area, if you go to a big academic place, any of those you'll be prepared for.
Fellows come out of here and they feel very comfortable going to all kinds of different careers all over the country. And that's kind of our priority as what we consider our priority as educators here.
We're training the fellows in reading like MRIs and really good quality MRIs at a high level, high quality level. It gives them like a little edge, a little advantage from other fellows to try to get better jobs or try to be more marketable.
Part of your procedural rotations in the program will definitely include oncology biopsies, bone biopsies, soft tissue biopsies, which are less common in the community. But in addition to that, there's quite a few procedures we do, including the pain management procedures and joint procedures that can be quite useful if you're practicing in the community.
A lot of technology that's being used at this program, which facilitates teamwork between faculty, fellows, technologists, residents, and others.
All the magnets are equipped with a full array of coils for specialized imaging and are completely up to date in terms of software, in terms of any kind of specialized imaging we would want to utilize them for. This includes any kind of metal artifact reduction sequences, motion reduction sequences, Dixon imaging. So I think the conferences are definitely one of the strong points of our program here, to get the fellows familiar and educated in a wide variety of topics with a good foundation in any kind of like orthopedic subspecialty that they may come across in their future development and their future careers.
Research is something that we love to participate in. We love to add to all of our various musculoskeletal societies and national organizations, contribute to knowledge. Sit down with one question and research it carefully and do a literature search and sort of think about really how to answer a clinical question in a very academic way. And so it's a good experience, but usually something that isn't tremendously time consuming.
So there are a lot of opportunities from research. All of the faculty members do publish, but at the same time, it's not a hard and fast requirement for the fellow to participate in research. So as far as the benefits, the thing that makes this program somewhat unique are the moonlighting opportunities, which are hard to beat and hard to find at other programs.
Oh, Richmond's a great city. Yeah, I'm from Richmond myself, so I'm a little bit biased, but Richmond's a very, very livable city. We've had fellows in the past come from all over the country and be here for a year or longer. Some decide to stay.
It's nice to know I'll have access to all sorts of experiences that a large city brings during this 12-month period.
It's a great city to be for just a year, very livable, easy to get around, lots and lots of great restaurants and breweries. The James River runs through the city, so we have lots of opportunities for hiking, kayaking, mountain biking.
Our goal is to send the fellows out from here feeling very confident in terms of their ability, both their procedural skills, their diagnostic skills.
So for our fellows, we want them to experience what is going to make them more marketable and what is going to make them more proficient in musculoskeletal radiology. Even if they decide to specialize in something else, we still want them to have a variety of knowledge of all the other things that we do.
You're able to learn all facets of musculoskeletal radiology quite well here.